I'm going to talk about I'm going to focus my talk on another theme: wartime children suffering and quest for therapy in northern Uganda. This is also a title for my doctoral thesis, which I did under the supervision of Dr. Annemiek Richters in Leiden University Medical Center in the Netherlands. And the co-supervisors were Ria Reis and Dr. Charles Rwabkwali. He's based in Makerere University in Kampala. Because I did my study in northern Uganda, it was a requirement to have a supervisor in the country where I'm doing my research. So that's why we had 3. But the policy requirement is that I have 2 supervisors for that doctoral study. My presentation is going to be organized as follows. I'll tell you something about the context, where I did my research, a disaster setting, a place where people had experienced armed conflict for 20 years. And I was there as an anthropologist, a medical anthropologist interested in health problems or health complaints identified by the persons themselves, not from outside. So it took me 1 year to assess this study, just like any anthropological study would, or an anthropologist would do. After telling you something about the context of the study, I'll also take a few moments to discuss my findings. And since this institute is also interested in child soldiers, I'll take a few moments later on to tell you how I arrived at the issue of former child soldiers. With some colleagues, I already told them that it was a mistake or it was a good accident for me to arrive on the issue of child soldiers. My research plan was school-age children, in fact, children who go to school and stay in night commuters' shelters. But in that context, I also found child soldiers. And the theoretical framework helped me to question the dominant discourse there. At the time of my study, people were being told, or NGOs were telling people, that child soldiers are innocent victims. They are forced to commit atrocities. They are not active, or they are not social actors in their own rights. But when I came to this context, I had a theoretical concept of child agency. I'll tell you something later on about the main arguments there. Under child agency, anthropologists believe that children can be social actors in their own right. They can make decisions, they can act on any stimuli. And they can also respond to commands according to what they think is right. So, for instance, if a commander orders the child to kill, under child agency, we believe that that child has an opportunity within himself or herself to decline. But if they carried out, or if they went ahead to carry out their atrocities to some extent, they are social actors. Under this theoretical concept still, we arrived at an argument that child soldiers need to be held accountable for their crimes. But we are also working with the concept of child vulnerability, which means that we are looking at a nuanced level, where we're looking at the child soldier as vulnerable because they were abducted, they were brainwashed, and they were forced out of their normal social lives and taken into armed combat. So our argument, as reflected in our articles, is not as black and white. we are trying to make a nuanced point of view. I will also have a discussion focusing on research, what we can do together as universities in northern Uganda or in Kampala and the University of Ottawa. But that is much later. For instance, I want to ask ourselves how it is possible to still research on former child soldiers who are now adults. Some of them were incarcerated in juvenile prisons because of crimes they committed now as reintegrated persons. Now they've been transferred to adult prisons. When they are released from there, what kind of life will they lead? How will the communities receive them? During my study, I asked very simple questions to the school children, mostly aged between 9 to 16 years. What are the common health complaints that you have in this community? And how do you manage these health complaints? Health was perceived as not only the absence of disease. So the person was free to tell me something about immediate health complaints and also mental health conditions. That's why we come out with a discussion about infectious diseases and quests for therapy. And also we discussed in this thesis psychosocial suffering, health complaints related to mental distress and emotional distress. When somebody loses a parent, is mentally affected, emotionally affected, those kind of complaints fall within psychosocial suffering. Infectious diseases, on the other hand, are very common in tropics. They are caused by bacteria, plasmodia. They're caused by microorganisms, which thrive in the tropics in warm temperatures. In my thesis, I divide it in sections. One section focuses on infectious diseases such as malaria, diarrheal diseases, skin infections, and the like. Another section focuses on psychosocial suffering. I talk about anxiety, distress, local idioms of distress. I also talk about how they cope with this distress. That's why we came up with an article, Silencing Distressed Children. One of the coping mechanisms was that because so many people had challenges, they had so much to deal with, children who wanted to express their distress, for example, in complaints, crying, looking for help from different counselors, were silenced. They were always told, there is so much suffering in this area. Somebody neighboring, your neighbor has so much to deal with compared to you. Yeah? So that is the logic there. Why do we divide this thesis into sections, and especially starting with infectious diseases? First of all, children mostly talked about infectious diseases. If you ask them, what are some of the health complaints that you have? Or in the last 1 month, what are the health problems that you had? Most of them would talk about malaria, diarrhea, and skin infections sometimes occurred in epidemics. Also Ebola affected the children in northern Uganda. And another very common epidemic, cholera, was experienced in camps. So in the first 1 month, every discussion that you engage, every child that you engage in a discussion will be talking about infectious diseases. And in our interpretation, we say that children readily mentioned infectious diseases because they are acute. When somebody has malaria, their health condition easily deteriorates, and they would need urgent medical attention. And then children's condition easily degenerates and required immediate therapy. And the therapies here, we talked about pharmaceuticals, like the pills, and also herbal remedies, those which children know, and the remedies which they get from neighbors or from other healers within the society. And then infectious diseases, of course, are primary and direct. Even children in primary schools or adolescents knew the symptoms of, for instance, malaria. Yeah? So it is direct. For mental distress or for illnesses related to psychosocial or such as psychosocial aspects of suffering and emotional distress, it took time for them to link like cause and effect. For instance, if I wake up very tired, if I didn't sleep last night, if I always have nightmares about an incident I saw a few months ago, those are symptoms or signs that you could link to mental distress. But it takes some time to discuss these issues with adolescents. And even more, it's like conditions you can live with. And you can proceed normally, like you go to school, but you have these forms of suffering. I'll come back to that later. And then infectious diseases have a unique characteristic that curative measures are available in northern Uganda. Unlike many developed countries where you need a prescription before you get even a first-line antibiotic, in northern Uganda you can get up to third-line antibiotic. Just you only need the money. Third-line antibiotics are more expensive, and they are stronger compared to like first-line antibiotics like amoxicillin and the like. All these are easily available in the market without prescription from the medical doctor. So because of easy access to medicines in northern Uganda, I took time to discuss what are the dangers in using or in easy access and overuse of medicines. I believe that most pharmaceuticals are actually poisons. It's a debatable issue, but if you have to take antibiotics every week, then your life is in danger somehow. Then psychosocial and cultural suffering, as I said earlier, they are relatively stable forms of illnesses that somebody can live with these conditions and continue functioning normally. You continue doing your daily chores, even with this kind of stress and distress. But right now there is a debate. Is it better to leave the person to live with this form of suffering until it resolves? Or it's better for it to be addressed just like infectious diseases are? And if you recommend that such illnesses should be treated, how are you going to treat them? How are you going to, for example, medically help a child who has to deal with the fact that he cannot sleep because his brother was abducted and he doesn't know whether he's alive or not? Yeah? So it's now a big debate, especially in disaster settings. To what extent can we help persons deal with psychosocial forms of suffering, anxiety, daily stressors, and emotional distress? Fortunately, many scholars also argue that for some forms of distress, time is a healer. If I cannot sleep now because I saw somebody being killed, perhaps in 5 years' time, I can try to come to terms with it, that, oh well, I couldn't do anything about it, and if I maybe try to fight back, I would also be killed. So I come to terms with this issue and I can sleep. Yeah, but to what extent is time a healer in this kind of suffering? Nobody can give a definite answer. For some people, it's recommended that you give them 7 years. Others say 7 years is really too long. It has already become pathological by 1 year. Yeah? So they say, let's leave the adolescent to try to resolve this experience within 1 year. If the person has not dealt with it and still has nightmares and is still startled, is still distressed, then we biomedically help this person. Scholars don't agree on what is the best time limit that we should give somebody, in which case we accept or we say that it is normal to have these reactions towards an extreme event, and then to say now the reaction towards an extreme event has become pathological, or the person is now sick and needs biomedical attention. For my doctoral study, we managed to publish together with my supervisors. Some of the articles are here. The most recent one is Experiences of Forced Motherhood in Northern Uganda, the Legacy of War. It's a paper in press. It should be available within next month. And then we had other papers. One of the papers we published was on former child soldiers, as I mentioned. But former child soldiers was just a small section in my study. I am pleasantly surprised by many scholars who send me emails to ask me about my article on former child soldiers and how I should discuss my work with different fora and the like. But it was just a small section about it. Yeah. And the thesis actually is here, and I will present it later to the Human Rights Research and Education Center. In the same study, we had some book chapters. And the issue of accountability keeps on coming up. Issues of accountability. It's not always our main focus. Like we want to make child soldiers or a person who was abducted when she was still young and was in armed conflict for many years and now he has come back. First of all, we want to look at this person as a survivor. Many of these children died while they were in armed conflict. So when they come back, what is the way forward? In a way that the needs of the returnee are met, as well as the needs of the community. Remember very well that the LRA frequently attacks their own kin, their own relatives. If I'm from Ottawa, I could come and attack people in Ottawa. So after 15 years of fighting, when I come back to Ottawa, how am I received? The most pragmatic approach by international aid agencies was to tell people that these children are innocent. They were abducted, they were brainwashed, and they were forced to kill. However, when these children come to the communities, they brag about their own experiences in informal settings, like when they are having a drink or at school during break time, they talk very freely. discussing, giving examples about how they killed in a particular school, how because of frustration also in the bush, they wanted some children also to join them, other school children to join them, so it was easy for them to target schools, to kill even, to take some children from school and to recruit them in armed combat. So you're discussing these experiences to other children whose relatives were killed, to other children who are asking every now and then, my brother was abducted. When am I going to see him? Is he still alive or not? So that's why we came up with the issue of accountability, in a way that child soldiers are told that it is not that you are innocent victims. Actually, you are accountable. But the way you are accountable is not like adults who commit crimes, but like people who are forced to commit crimes, and you're committing them in societies where you return, and they are vulnerable societies. Actually, emotionally, they are still suffering. How do you interact with them? That's really what we want to put across to different scholars and also to intervention agencies. Fortunately, the World Bank has somehow adopted this concept of making people accountable, but when they meet, like in a way that it meets the needs of the societies and also needs of reporters. In the recent study, we are talking about family dynamics here, but we are interested actually in how the reporters or the ex-combatants reintegrate in the communities. Yeah? The communities being viewed as extended families. The Ugandan approach was to award certificates to all reporters and also go to the communities and tell them, if you don't accept these people as part of you, they are likely to go back in armed combat and cause more harm. So you suppress one side so that you can make the reporter try to live a normal life. But this is 10 years later. Are you still going to promote the same discourse, or you really now need to change and now look at the needs of the community regarding either retribution or social justice? Yes. A reporter. A reporter is the same as an ex-combatant. In the World Bank speak, they call them reporters, but in reality they are ex-combatants. The only difference there is very subtle. A reporter is a person who was abducted or was forced to join an armed rebellion, compared to a person who willfully joins an armed group. But the distinction is really very subtle. In practice, people who willfully join armed groups easily learn about this concept, and they actually abuse it. You find somebody who was a commander telling you, I am a reporter. I was abducted, simply because Amnesty Commission will readily give them certificates, compared to if you report to the Amnesty office and tell them, I am one of the persons who founded this rebellion. Okay. I have already discussed this at length. The situation as I found it in northern Uganda, and how I questioned this discourse in my doctoral study. You cannot tell a community which even so children are attacking camps that they are innocent, that these children are innocent. They are very vulnerable. You need to accept them. You need you need to forgive them. Yeah, they're even traumatized and so on. It doesn't make sense. Their response actually was that they discriminated against them. They attacked them even, though it was illegal to do it. So if a child soldier was bragging about their experiences, they're supposed to listen and forgive the child. That is at that time, but presently things are changing. What was also confusing for the community is that they were advised to forgive child soldiers. You first tell them that the child is innocent of armed conflict, but you tell them to forgive. This was contradictory. And instead we are proposing that if you're going to tell the community to forgive child soldiers, it's better you tell them that child soldiers committed atrocities, so that a person is forgiving trespasses and not forgiving innocence. There it makes sense and it is more acceptable by different societies in Uganda. In a paper I had written, which was posted on the website, or the advert was posted on the website, I wanted to also talk about the different interventions. For example, stepping on an egg, yeah, and cleansing ceremonies, which were conducted very frequently in attempts to make the community accept child soldiers. But all these were ceremonies which were important at that time. Presently, nobody knows if these ceremonies were even valued, because the ceremonies were meant to facilitate reintegration of former child soldiers. But all these projects failed. For example, Save the Children Fund did an assessment in 2005, just 3 months after doing such a major ceremony, like let's make child soldiers step on an egg and do some cleansing ceremonies so they can be accepted by the community. But 3 months later, there was no child soldier in the community where they were reintegrated because of revengeful acts against them, because of the community rejection. And in disaster settings, such interventions are very common. In fact, even humanitarian aid agencies contradict or conflict among themselves concerning what is the effective way, or what are meaningful interventions, and what are interventions which are just there like to pass time. You have written a proposal, you have justified it that people are traumatized and they need maybe talk therapy and psychotherapy, but when you reach the community, they tell you totally different needs. And yet you have a grant for 5 years. What do you do with it? Yeah. So in disaster settings, sometimes things become so bizarre that you don't know whether to criticize or to appreciate the intervention. Yeah? Maybe I should stop there so that I have more time for questions. Thank you very much for listening.